Hello, my name is Andrew Call, Director of Operations at VADA. I would like to personally thank you for taking the time to find out more about our anatomical healthcare models. VADA has been producing some of the most realistic and educational models in the industry for over 26 years. Comments and feedback are always welcomed and encouraged, as we are interested in your specific needs and any new product ideas. Please stand by to find out more about our anatomical healthcare models.
Today, we'd like to introduce you to auto-ostomy. For years, clinicians have literally begged us to introduce an ostomy model. After years of development and testing, we're proud to introduce auto-ostomy. This one-of-a-kind model helps clinicians, staff, patients, their families, and friends become more knowledgeable about what to expect while learning how ileostomies, colostomies, urostomies, and gastrostomies are formed and function. The more healthcare providers understand about ostomies, the better equipped they'll be to educate and encourage their patients about this life-changing event. Preoperative teaching allows patients and their families to begin learning about ostomies prior to surgery when they're less distracted, thereby reducing anxiety. To a great extent, ostomy care can best be described visually. Nurses have explained to us that patients don't really understand what has happened until they see and understand how their plumbing has been rearranged. With auto-ostomy, healthcare staff and patients can visually grasp in a life-sized 3D model what they may have had difficulty understanding or attempting to explain from pictures and a verbal description alone. Seeing the 3D digestive and urinary tracts and visualizing the location and function of the various organs is essential to learning, especially in those cases where cognitive processes or language may be an obstacle. Proper teaching helps increase patients' understanding of their condition and any adjustments which may be necessary for achieving a satisfactory standard of life with their new stoma. Let's begin with a brief overview of the model. The organs on the model were molded from an actual patient CAT scan, helping ensure realism as well as accurate size and placement. To review the organs, here's the distal end of the esophagus emptying into the stomach to the small intestine, the large intestines, the rectum, 2 kidneys, the ureters, the bladder, and the urethra. Auto-ostomy can be used to demonstrate 6 different ostomy procedures. To demonstrate a loop ileostomy, select a double stoma and insert it into one of the 4 stoma openings in the clear torso shell. Attach the pink ileostomy loop adapter to the back side of the double stoma. Separate the flexible pink small intestine segment from the red ascending colon at the ileocecal valve and attach the end to one of the 2 male connectors of the loop stoma. Magnets on each side will gently pull the 2 parts together when in close proximity. Take the second flexible pink small intestine segment and attach one side to the red ascending colon at the ileocecal valve, and then place the other end on the remaining male connector. You can now show how a loop ileostomy is formed. To demonstrate an end ileostomy, all, part, or none of the distal intestines can be removed for demonstration purposes. Separate the flexible pink small intestines from the red ascending colon at the ileocecal valve. We will remove the large intestines, but leave the rectum for this demo. Select a stoma and insert it into one of the 4 stoma openings, and attach to the male taper of the stoma. Magnets on each side will gently pull the 2 parts together when in close proximity. You can now show how an end ileostomy is formed. To demonstrate a loop colostomy, select a double stoma and insert it in one of the 4 stoma openings in the clear torso shell. Attach the red colostomy loop adapter to the back side of the double stoma and push forward. The large intestines can be separated in 4 locations. For our demonstration, we will separate the large intestines at the mid-transverse colon. Take the 2 ends and attach them to the male and female connectors on the back side of the double stoma. Magnets on each side will gently pull the 2 parts together when in close proximity. You can now demonstrate how a loop colostomy is formed. To demonstrate an end colostomy, the large intestines can be separated in 4 locations. For our demonstration, we will separate the large intestines at the junction of the descending colon and sigmoid colon, then remove the sigmoid colon and rectum. Select a stoma and insert it in one of the 4 stoma openings in the clear torso shell. Take the distal end of the descending colon and attach it to the stoma. Magnets on each side will gently pull the two parts together when in close proximity. You can now demonstrate how an end colostomy is formed. To demonstrate a urostomy, select the stoma with the two white stents and insert it in one of the 4 stoma openings. Take the 8-inch pink flexible ileal conduit, which would have been surgically resected from the small intestines, and attach the open end to the stoma. Remove the distal end of the ureters from the bladder. Next, remove the bladder. Insert the ureters into the openings in the ileal conduit. You can now demonstrate how a urostomy is formed. To demonstrate the placement of a gastric tube, slide the torso shell to the back of the stand. Take the gastrostomy tube and insert it through the top opening on the torso shell, and then through the opening in the stomach wall. Inflate the balloon, then pull back on the tube while pushing forward on the retention ring until it is flush with the torso shell. You can now demonstrate how a gastric tube is formed. There are 2 stoma packages available. The autoostomy standard model 0300 is supplied with the following 4 stomas: 7/8 inch diameter stoma, 2-inch diameter stoma, urostomy stoma with 3-inch stents, loop with rod. Both models also include ileal conduit, small intestine segment, ileostomy loop adapter, colostomy loop adapter. The autoostomy advanced model 0310 includes the 4 stomas that come with the standard model, plus the following 14 additional stomas: loop without rod, double barrel, oval, mushroom, prolapsed, 3-inch diameter, granuloma, necrotic, ischemic, in-skin fold, peristomal hernia, mucocutaneous separation, recessed, and flush. Individual stomas are also available. For transporting and protecting your model, there's also an optional carrying case available, which houses the model on one side and the standard or advanced stoma package on the other side. As you can see, no detail has been left out. Autoostomy is the most comprehensive and complete model of its kind. For the first time, clinicians can quickly diagnose problems, plan, implement, and evaluate care specific to the simulation displayed in sim labs. In addition, staff can demonstrate their proficiency in competency testing, producing greater confidence and better patient outcomes. Thank you for taking the time to learn more about autoostomy. Please contact VADA at any time to learn more about our other anatomical healthcare models for IV, wound care, ostomies, and much more.